Enlarged tonsils and adenoids are common conditions that can affect both children and adults. Tonsils are located at the back of the throat, while adenoids are located in the upper part of the throat, behind the nose. When these tissues become inflamed or infected, they can become enlarged and cause various symptoms such as difficulty swallowing, snoring, breathing problems, and recurrent infections. In some cases, enlarged tonsils and adenoids may need to be removed through a surgical procedure called a tonsillectomy or adenoidectomy. This can help alleviate symptoms and improve overall health and quality of life. However, it is important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment options. Adenoids are small glands located at the back of the nasal cavity, near the throat. When these glands become swollen or enlarged, it can lead to various symptoms. Some common symptoms of adenoid problems include difficulty breathing through the nose, frequent snoring, a stuffy or runny nose, recurrent ear infections, persistent sore throat, chronic cough, and restless sleep. In children, adenoid issues can also cause behavioral problems, such as irritability and difficulty concentrating. It is important to consult a healthcare professional if you or your child are experiencing these symptoms to determine the appropriate treatment plan. Tonsils and adenoids are important parts of our immune system located in the back of the throat and nasal cavity, respectively. While they help in fighting off infections, they can sometimes become problematic and lead to complications. Common complications of tonsils and adenoids include recurrent infections, such as tonsillitis and adenoiditis, which can cause symptoms like sore throat, difficulty swallowing, and nasal congestion. These infections can be recurrent and may require medical intervention, including antibiotics or, in some cases, surgical removal. Other complications can include sleep apnea, where enlarged tonsils and adenoids obstruct the airway during sleep, leading to snoring, interrupted breathing, and poor sleep quality. In some cases, this may require the removal of the tonsils and adenoids to improve breathing and overall health. Tonsils and adenoids are part of the body's immune system and help to fight off infections, but when they become enlarged or infected, they can cause a range of symptoms such as sore throat, difficulty swallowing, and breathing problems. The treatment for tonsils and adenoids may vary depending on the severity of the condition. In mild cases, conservative management with rest, fluids, and over-the-counter pain relievers may be sufficient. However, if the symptoms persist or worsen, medical intervention may be necessary. This can include antibiotics to treat infections, or in more severe cases, surgical removal of the tonsils and adenoids, known as a tonsillectomy and adenoidectomy. This procedure is usually done under general anesthesia and involves the removal of the tonsils and adenoids to alleviate symptoms and prevent recurrent infections. It is important to consult a healthcare professional to determine the most appropriate treatment option for tonsils and adenoids. Adenoids are small glands located at the back of the throat, and their main function is to help fight off infections in children. The most common cause of enlarged or infected adenoids is repeated or chronic infections, such as bacterial or viral infections like the common cold or sinusitis. These infections can lead to inflammation and swelling of the adenoids, causing symptoms like difficulty breathing through the nose, snoring, and recurrent ear infections. In some cases, adenoids may become enlarged due to allergies or genetic factors. If adenoids cause persistent problems or significantly affect a child's quality of life, they may need to be surgically removed in a procedure called adenoidectomy. Nasal spray for adenoids is a medication that is used to reduce inflammation and congestion in the adenoids, which are small glands located at the back of the nose. Adenoid inflammation can cause symptoms such as difficulty breathing through the nose, snoring, and recurrent ear infections. The nasal spray works by delivering a corticosteroid medication directly to the affected area, which helps to reduce swelling and improve airflow. It is typically used as part of a comprehensive treatment plan that may also include saline rinses, antibiotics, or surgical intervention in severe cases. Gargling can potentially help with adenoids to some extent. Adenoids are small glands located at the back of the throat, and when they become enlarged or infected, they can cause various symptoms such as difficulty breathing, snoring, and recurrent infections. Gargling with warm salt water or an antiseptic mouthwash can help alleviate some of these symptoms by reducing inflammation and killing bacteria in the throat. However, it is important to note that gargling alone may not completely resolve adenoid issues, and medical intervention may be necessary in severe cases. It is always advisable to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan.